Hello and welcome back to GP Video Podcast by Nadia. So today we are still talking about menopause, so menopause part 2. So I shed a lot of light yesterday on the definitions, spent a lot of time in explaining what is menopause, which is the last day of last menstrual cycle, so it's just one day. While perimenopause is the period that leads up to the day of menopause. It could be a few months, it could be a few years before, and then it lasts up to exactly 1 year after the last day of last menstrual period, which is the menopause day. Postmenopausal women are the ones who have had menopause for 1 year. So after perimenopause, not premenopause, perimenopause, peri means around, so before and after. And after 1 year of menopause, then women are called postmenopausal. So these were the definitions that we shed light on. And what are the symptoms? Because the hormone levels are up and down in this perimenopausal and then of course postmenopausal period, they are going to be down only. So in perimenopausal period, because the hormones are all over the place, and women are having anovulatory cycles, like the ones in which there are not going to be ovulation, women are not ovulating. So there could be any sort of symptoms. You can have bleeding 3 times in a month, or you can have the frequency of the bleeding is changed, which is 3 to 4 times a month, or you're having them only once a month, but you're having very increased quantity or very less quantity. So again, because estrogen and progesterone are all up and down, and because entire body has got receptors for estrogen and progesterone, so you're not only going to get the gynecological symptoms, but you're also going to get all the bodily, physical and mental health symptoms like mood disorders, anxiety, depression. You're going to get brain fog. So you would feel like, oh my god, am I getting demented from now? I can't remember anything. I can't remember the shop that I went to yesterday. I can't remember my friend's name. I can't remember the cafe that I went to the other week. So no, these are not signs of dementia, presenile dementia. These are the signs of menopause. Okay, so again, headaches, because if estrogen is increasing, then you can get headache, you can get breast tenderness, disruption or irregularity of periods, sleep disturbance, brain fog, weight gain, hot flushes, night sweats, urinary frequency, vaginal dryness, loss of libido, muscle aches, bone aches, palpitations. So all sorts of symptoms of the body are involved. Okay, and then now I'm going to jump onto the treatment part. So treatment can be divided into non-hormonal and hormonal treatments. So non-hormonal, we'll talk about them later, because they are still off-label, like they are not on PBS yet, and there are a few types, and they are also very, very good, but we will talk about them after the hormonal treatment. So with the hormonal treatment, let's start with who gets what and when. So first of all, let's decide who are the ladies who cannot go on hormonal HRT or hormonal menopausal hormone therapy. So the ones who cannot have it are who have had breast cancer or endocrine or reproductive cancer that's hormone dependent. So the ladies who've had these cancers usually cannot have hormone replacement therapy. Number 2 is undiagnosed unusual vaginal bleeding till it gets sorted out. So sometimes when the bleeding is more and less during the menstrual period, again, it can be mistaken for undiagnosed vaginal bleeding. But once we have done a pelvic ultrasound scan and we have seen everything is fine, then we can get the HRT. But if it is an undiagnosed vaginal bleeding, because it could be one of the signs of uterine cancer or cervical cancer, so those ladies cannot have it. Then if somebody has active cardiovascular disease like a recent heart attack or stroke, those ladies cannot have it either. Current blood clot, they cannot have it either. So history of breast cancer or uterine cancer or cervical cancer or any other endocrine or reproductive cancer that is dependent on estrogen and progesterone, if you have had, I'm not talking about family history, I'm talking about your own history, that's hormone dependent, you cannot have it. Undiagnosed vaginal bleeding till it gets sorted out. Active cardiovascular disease, stroke or heart attack, you cannot have it. Active, again, just please pay attention to what I'm saying, okay? And current blood clot, active disease, own history of breast cancer or endocrine or reproductive cancer, and undiagnosed vaginal bleeding till it gets sorted out. Now, again, So we have decided which women can have it and which women cannot have it. So the women who do not have any of these risk factors, then we have to have a look at the factor whether that woman has uterus or not, because that also affects the treatment. So if, for example, uterus could be removed for any purpose, have had fibroid, have had menorrhagia because of any reason could be there. It doesn't have to be uterine cancer for the uterus to be removed. So if the uterus has been removed, then we need only estrogen, because estrogen is basically the hormone that's going to treat all the symptoms. It's not the progesterone, it's the estrogen part that's going to treat all the symptoms that I have mentioned. But so the women who don't have a uterus, we only give them estrogen. But the women who have a uterus, we have to give them both estrogen and progesterone. Why we need progesterone in the ladies who have a uterus? Because estrogen works as a fertilizer to the lining of the uterus. So it actually grows it. And then if we have unopposed estrogen with the ladies who've got uterus in, that lining can, if we don't have progesterone, because what progesterone does, it thins out. It thins out, estrogen makes it thick and progesterone thins it out. It's like a lawnmower. So if we have unopposed estrogen without any progesterone in the ladies who've got a uterus, then that lining will get on getting thick, and it will then change into endometrial cancer. So to stop the uterine wall from getting very thick and getting into cancer, we have to have progesterone on board to lawnmower, to just make it thin and nice. So the ladies who do not have uterus only need estrogen, and the ladies who have got uterus need both estrogen and progesterone. But another exception is for the ladies who don't have any uterus but have had endometriosis. Endometriosis is the formation of endometrial uterine tissue in other parts of the body except for uterus. They also need both uterus and progesterone. So women with no uterus, only estrogen, except for the women who have had endometriosis, they will need both estrogen and progesterone. And the ladies with uterus, definitely they need uterus. They need estrogen and progesterone. We'll come back to this topic tomorrow.